Welcome back. All right, can we stand for the Pledge of Allegiance?
I have pants on.
Oh, yeah, I do this time too. Oh, look, a flag.
Ready?
Yep.
I pledge allegiance
Pledge allegiance to the flag of the United
States
States
of America,
and to the republic
for which
for which it stands, one
one
nation,
nation,
A nation
under God,
under God, indivisible,
indivisible, with
liberty
with liberty and
justice
justice
for
for
all.
all.
Thank you. All right. Well, everybody looks good. Kate's still with us. For a little longer, right, Kate?
Down to my last 2 weeks.
All
Oh.
right.
And then hopefully not for a very long time after that.
Yes, you're absolutely right.
Smiling. Now she smiles.
Sounds good. Sounds good. Everybody's healthy with all this coronavirus
Knock wood.
stuff. Knock on wood. I know. I know. How are you doing in the city with it, Joel? You must be going
It's
crazy.
really starting to pick up again. Big time. All over the place, I think. The problem now is everyone has to get back on board with questioning and questionnaires to try to screen the calls. And, everyone thought we were done with that, I think.
It didn't, huh?
So we kind of have to do it ourselves.
Wow. I don't know how you do it in the city because that's a crazy place. Okay, no public comment.
Is there any public here? Normally I can see it, but I don't see it.
No, we told them not. We told them to go home.
Everyone's
You
always so
lock the
interested
door.
in my meetings.
No, no public. Past minutes, approval of the past minutes from last month. Somebody want to make a motion?
Sure, I'll make a motion to approve the minutes.
I would
And
love to second it, but I never got them. But I have to check that with Kate.
Oh,
I sent everything out yesterday. I miss you, Joel. I'm sorry if I did.
No, I don't know do you have what email address are you using?
I'd have to double check at work tomorrow.
I'll let you know. I'll give it to you if you want to just write it down quick. and you
Yeah,
can-
if you don't mind, that'd be great. Make sure I have the right one.
It's Joel, Joel, at B as in boy, CCC3Cs.com.
Yeah, I'll double check that I have the right email address. I'm sorry if I
No
don't.
problem. No, not a problem.
Jeff, would you like to second the motion for the minutes for last month?
I will second the motion.
Okay, anybody have any comments, questions, anything about the minutes that they would like to bring forward? No? Okay, we can take a vote. All right, everybody in favor, say aye.
aye.
Okay, I guess I'll have to do it too, because I'm the fourth person. All right, okay, that was unanimously. And, oh, yes, you can. Chief, you ready, Chief?
I'm ready.
Before you get retired,
Yeah, before I go to pick up my Trader Joe's floral shirt.
right?
Yes, let me pull up my mock chief report that I'm almost finished typing. 1 second. All right, there it is. So what can I tell you? So community engagement this month was a really great month for us, working with Trumbull Public Schools. I was very excited when they reached out to work on their sudden cardiac arrest plans, which is something that we're very passionate about. Just working with middle school, Hillcrest Middle School and Trumbull High School, but obviously we're pushing to expand this to all the schools. They put together their own medical emergency response team plan. They sent it over to us to review. We gave them a little bit of our feedback and guidance, and then we created a high fidelity drill with them where we went to the school, we brought our high fidelity mannequin. We actually got the dispatch center to come down with their training thing so we could hook them up. So when the school called 911, it actually goes to the dispatcher that's there, and they ask all the questions like it's a real event. And then they dispatch us on our own channel like a real event. And we made them kind of wait that time so they could feel like those minutes ticking by whilst they're waiting for us to get there. It was really, really well received at both schools. We did it at Hillcrest and Trumbull High School. We had a great after action review. I wrote them some, guidelines or suggestions on things that they might want to consider. That, they gave us some things that were very helpful. So very excited about that, and hoping that we can continue to do that with all of the schools, because it shouldn't really just be about students going down, but also just any adult in the school environment going down. So I think Trumbull's doing really well with that. We had a few community visits, Daisy Scouts, all of those things, and I'm probably forgetting a few, but you will catch up in tomorrow's report that is going to be in your inbox. Volunteers, we're still doing really well. The new preceptees, I think we actually have already quite a few that are looking to clear out. And we have another full class of volunteers waiting to take their orientation training and sign on with us. So I don't know, in the time since I've been here, this is the last 3 months, I've never been in a position where we have so many volunteers asking to come work for us. We have a volunteer paramedic who's about to be cleared to hit the road with us. So it's going really, really well. And I think morale's pretty good with that. What else can I tell you? Lots of education classes. We did a lot of really good classes. And then I just shut down the building right now as of last week. So thank you to the technology department. Just before I did that, they helped me figure out how to get this microphone that I can attach to my laptop. So we can actually have a speaker here and present them via Zoom to a larger audience. For now, that's basically going to be, we'll either have the presenters go via Zoom, which a lot of them would prefer to do so they don't have to come in, or they'll come here but only present to on-duty crews, and we'll Zoom it out to everybody else. And I think it'll be good for our EMT class that's upcoming. Right now, it's still slated as a hybrid class, and we have a full backup plan to go full online if we needed to. But I think having this option will allow us to potentially still keep it hybrid and simply split the class in two. So we could potentially have 5 people in person and the others on Zoom, and then switch that around so people can still come in and do some hands-on stuff. So I think we'll keep going, and hopefully we won't have to keep the building shut for too much longer. We did have quite a few good speakers that were going to come down. One of the things that we've added to our ambulances, it's not out yet, is Carter kits. I don't know if you've heard of them, but they were designed by a small company for children with autism and sensory disorders. So we basically have this bag, I actually have it here. I'm just gonna grab it. So it's this bag, and it's full of things that are gonna be really, really helpful for people with, a sensory disorder, children with autism in particular. So they are gonna do a Zoom for us before I put these out on the truck. Just in, we had a presentation, I think a year or so back on how to best, deal with children with autism and sensory disorders in an emergent setting. And I just thought this would be a great way to do it. So it's got all these kind of like little small kind of items that are meant to be very helpful, and they're going to talk us through using them. And it comes with these fantastic like sensory headphones that they can put on to block out the noise. So we are hoping there's a weighted blanket in each kit. We'll get some guidance from the people who made these kits on how they use them and how they envisage us using them. I don't think they're just for children with autism, and that's where the guidance is, but I think anyone that was struggling in that environment that could use these will be really helpful. So very big thanks to the association. I'd asked them if they would kindly purchase the first 10 kits for us so we could have 1 kit on every ambulance and two spares. And I'm kind of excited, just keep pushing on with our patient-focused approach to care. And I think this is just going that one step further for those children that would really be struggling at the best of times, let alone in an emergency. So another clinical update, I'm just putting a proposal to the town now to go ahead and purchase IV pumps, because I really think that with COVID kicking off again, that it's important that we still be able to aggressively manage a CHF airway if we need to. And with CPAP and all these aerosolizing procedures being out, I think that IV nitroglycerin is going to be what saves lives, truly saving lives in those situations. So I am putting it forward right now as part of the, to see if we can get it pushed through. I was waiting to do that for next year's fiscal budget, but I'm going to try to push it now. I actually feel like it's something that should be covered by FEMA. because it is very much at the moment pandemic related, because it's a treatment plan, a realistic treatment plan that could save lives directly, because a treatment is going away because of the pandemic. So I'll let you know how that goes.
What's the cost on that, Lee?
I have it right here. This is the best part of having meetings on your own computer. You can pull it right up. I'm getting a presentation from the one that my operations supervisor is recommending, because I asked him why he thinks we should go with this one, so I'll let you know. But it is here under IV pumps. Okay, here we go. So the pumps range in value, like from anything from the one that we're looking at is $700 a unit. Some of them are 1,000. The other two that we looked at, one was almost, both of them are almost $2,000 per unit. And then you get the cable, the batteries, like spare batteries for the units are around 12 bucks on, ongoing. The drip sets are $15. My computer just made it go away. Everybody's computer hates them today, it seems like. There it is. Yeah, so the one that we're looking at is $700 per unit, but then they had mentioned something about a $500 care package, and it wasn't making sense to me. If I was going to spend $500 on care and $700 for the thing, I would just maybe replace it if it broke. But that's the people that we're meeting with, because he was saying it might just be that they actually give you a new one every year. So I'm looking into it. We looked at what other people are using. Joel, I don't know if you use one that you would recommend.
I'd have to actually talk to the transport unit and see what they're using. I know they have a ton of pumps. So let me see what they're using now.
Yeah. So we're going to look at it. I mean, we use Levofed right now with the Dialaflow. It's not ideal. And I just think with such a truly very impactful medication, that an IV pump is the safest and most efficient way to do that. And then obviously we could use it for Levo. And maybe people might use it more because they're less scared of the pump than the Dialaflow. So yeah, we'll see, but I do think it's going to be a worthwhile addition to our service and the care that we can give, particularly with the pandemic. And it's, again, after the pandemic doesn't go away, it's a great treatment model. So
yep.
And Lee, how long do you anticipate will take to get approval for that?
Well, I was going to present it at next week. And then it could be anything from fairly immediate if I can get buy-in to put it through the FEMA account. Mm-hmm. I've already strategically explained it to a couple of the people that are involved with emergency management and stuff, but I'm not 100% sure, to be honest.
No, because if they don't, we always have special agency, money as well.
Yeah, absolutely.
Right.
Absolutely.
If they don't have an answer by next month, we could probably move forward with that.
Yeah. That would
I think it's worthwhile.
Yeah.
Yeah, I mean, I think it's a really good investment, and really good for the patients. So,
Lee, do you know how much we have in that in special agency?
I can pull it up, but we still have a fair bit.
Oh, do we? Okay.
Yeah, no, we do. I mean, it's definitely
So that might be
tens of
something
thousands versus the less than that. I
Then-
just keep bookmarking it.
we should keep an eye on that to make sure we don't lose it. So that might be something we should
Yep,
try and get. What do you need? 3 or 4 of them? You need 4?
4. We need 4 to start.
Well, that's
And
like
the thing is, I'm happy to do that. It's just that I might be planning on asking you guys to use the special agency if the whole blood protocol comes out, so we can buy all the stuff that we need to bring that on board.
And what does that run roughly?
I got to look. I don't have all the data in yet. We're just looking into that. But it's basically we'd need bigger fridges than the fridges we currently have, like more industrial ambulance fridges. And then there's some drip sets and other stuff. I can pull that up for you guys.
Hey Lee, who's pushing the whole blood right now? Is Bridgeport pushing this at this point?
Bridgeport's, I believe Bridgeport are. So when it initially started with whoever was trialing it at AMR, was it Waterbury or St. Francis, and then Bridgeport had said they were looking into it, and I just recently heard that it sounded like it was pushing forward. So I'm not sure.
Yeah, I haven't heard anything recently, and they have a new director of the blood bank, and he's just trying to figure out where the bathrooms are. So, and we're also trying to get a blood fridge in the actual trauma bay right now for the purposes of resuscitation. So, as far as the whole blood protocol, I asked about the St. Francis one the other day when I was chairing the state trauma committee, and it's in its infancy. That's a major investment as far as refrigerators and quality control and everything else, if you do go with that, like in the tens of thousands of dollars. So unless you know something, unless you know some people. So, anyways, yeah, it's at its infancy, unless you've heard something different from Bridgeport.
Well, I recently heard somebody, basically, because I had put it out there saying, if you need a beta tester, Trumbull's always, a good site for that to, if you want to consider that. And so a couple of weeks ago, someone had said, well, it looks like it's moving forward. You should start thinking about that from a budgeting perspective if you're still interested. Whether there's any back to that, I didn't get a chance to follow up with them. So,
well, we probably should exhaust, the FEMA stuff and the town before we go into the special funds anyway. But it's nice to know it's a backup for the pumps. So
yeah, absolutely. So that is that on the clinical side. Call volume crept up a little bit this month, but we're not nearly where we normally are, but we'll work on that. I was talking to my billing company today. They're going to be giving us a dashboard in the new year where we can actually access and pull our own reports. But whilst we were playing around in that, I was looking at where we are, and I still think we're doing really well relative to the impact of COVID. I think we're still on target to be making a reasonable revenue generation from what we're doing. It's just still going to be that little bit lower because we're just not doing the calls, and then the calls a lot of them are BLS. So special operations, our special operations team got a surprise practice run on Friday night when there was an incident in town that where there was a potential active shooter.
At the mall.
In Bridgeport Hospital for stepping right up with that. It was a little frustrating for me, that situation, because I felt like on the town side there wasn't quite as much communication as there could have been. And I did reach out to Chief Lombardo today. We had a nice chat on the phone, and Megan Murphy over at Emergency Management. Social media is going to explode these things whether we like it or not. Social media are going to decide it's an active shooter before we do, and that's really frustrating. But from just a situational awareness standpoint, if there is an event that has the potential to be like that, we should probably know what's going on. We should probably, if there's going to be a car chase down Main Street, I should probably at least know that I don't want my units going that way if they can avoid it. So we just discussed the possibility of some better communication, hopefully offline, via VOC or something, not with the people that are tactically involved, but having a designated person at the police department that wouldn't be involved in the response, that could kind of just give an offline heads up to EMS, emergency management, anyone else, IT people, whoever comes in and helps. Because I didn't have a lot of information at all. And it was very hard to get hold of any information. And it was a little frustrating to be getting the information, whether wrong or right, via social media. So we kind of discussed that today. Chief said he's going to look at some options and strategies to make sure that doesn't happen again. But sorry,
Lee, was there an ambulance there at any point?
No.
See, I was at the mall.
EMS was not requested at all to this event. EMS was not told about this event. EMS actually had a phone call from one of our members who had a phone call from his friend in Easton, who's a dispatcher. I was leaving. I was walking out the door to go home. And, my supervisor was like, active shooter at the mall. I'm like, nope, that's somewhere in middle America, wrong town. He's like, no, it's Trumbull. I called CMED. CMED said that they could confirm that there was a report of a shooting at the mall, but they had not received a request from Trumbull for help. So at that point, it starts to get a little bit more realistic. I had every faith, and I still do, that if, the police department felt EMS was needed, they would have called for us, but I also felt that there wasn't quite enough communication for me. And I didn't want to bother PD during the middle of their tactical response to try to figure out what was going on. You know, Bridgeport Hospital activated off, you know, I can only assume is the press, because I wish I could say it was me, but I didn't notify them because I didn't have enough information to give them. I know people, you know, I had a lot of phone calls from regional partners, mutual aid partners saying, you know, I'm watching Doing It Local evacuate your mall. Yeah, and I'm like, no, everything's fine. So EMS did not respond, but in that moment, so pretty much, you know, when I spoke to Shay, I knew the hospital was activating and ready if we needed them. I reached out to, you know, my EM, and at that point, we also activated basically our special operations incident response. I was so incredibly proud. Honestly, we had so many people, boom, they were at the building. I had both of my supervisors that were off duty came in, one of whom was his birthday, by the way, who had asked for the night off, turned right around and came back in, and we were ready to go. We had, you know, several plans, and I then had made several calls to like mutual aid partners just on standby. So I'm fortunate, very happy, grateful that we didn't have to even deploy one ambulance, but we were ready to deploy all 5 of our ambulances that night, plus both fly cars, plus an EMS triage operations person and me as an IC. So that felt pretty good. And it felt good to not have to use it either, which is good. So what was actually great, boosted morale. We have a lot of interest in the special ops team now, which is good too, from a volunteer standpoint, you know, because I'm always looking for that, you know, those middle of the night standbys when we have to stay at a fire for the whole night long. I've been trying to put together a page crew of people that I would page out and they'd come in and then put another ambulance up to cover the town. And I haven't been that successful, but I feel like I'm going to be really successful at the moment because they're very excited about our special operations team. So,
I was very surprised no one was there.
So Lee, just one thing. Thank you for the communication. I know from Paul Pacenti to Wes to myself, we really appreciated, you know, knowing early. Yes, our ED was immediately on standby, so that was fine. The ICUs were on standby, and it takes just a couple phone calls. 2, I agree with you. I think we both found out by Doing It Local.
Yeah.
I'm like, really? You know?
Right.
So that's our source of information. I saw that, I think maybe the same time you saw that, which was about 2 minutes before. Yep. And, you know, early notification is key. And the only other thing that I can say too is just out of a page when we responded to that gentleman who was stuck in the tree about, now it's got to be 3-4 years ago. If you reach out to myself or Paul, usually I'm accessible. We can actually go to the scene too, if need be.
Absolutely.
So we have some capability. So that's another sort of like added thing. So when you were talking about the reason why I bring it up is you talked about special ops, and if there's some thought of trauma or something else, and then you could get a higher level practitioner like a PA or a physician at the scene. Sometimes we can bring instruments, et cetera, but you know, it's only relevant, say, if there's an amputation that's needed or, you know, torrential bleeding that's potentially tamponaded in the short term. But we have to be a little creative about it, but nonetheless, we actually can respond. So, but overall, the communication I thought was just awesome between yourself and what we knew. It's just a matter of, it'd be nice if you had that early notification too.
Yeah, absolutely. No, and it would be great. It was great. It actually was just great knowing that you were a phone call away, even just from an advice standpoint, like, should we bring you guys to the scene or not? That's super helpful. But I definitely, you know, I'm hoping to work with the town over the next couple of weeks to make sure that we definitely have, there just needs to be more communication. It's just nobody should be, firstly, I shouldn't be activating a response at all based off of Doing It Local. But I sat there in that like limbo of what if I don't, and what if it's true, you know, and I chatted with Chief about that. It's not that I don't have faith that they were going to get to me, but if we could be prepared before they needed us, we should be, you know. So I think we'll do better next time globally, but
sounds good.
There won't be one. Yes.
That was
Yeah,
frightening.
yeah, it was a terrifying reminder, I guess, and for EMS and I think for PD as well. I mean, we had just finished a fatal
Right, Canoe Brook.
NBC that was, we're kind of figuring out. There's a lot going on, so but we all stuck around. And it was good. So the team did a great job.
Okay, do you have any more to report, Lee?
No, I'm gonna call it there. It's Thanksgiving.
Okay. All right, we're back up to old business. Anything on the pandemic COVID-19 report?
So like the only real update, absolutely the numbers are going up. It's hard to do statistics when you've had kind of 3 months of like no cases, because I can kind of categorically say that, our case numbers are up at 100%, but that's because we had 2 cases last month. But we are having a steady stream of positive cases. The only very intriguing to me factor is that in the initial surge, 80% of our confirmed positives came from nursing homes. And in this current surge, 80% of our positives are coming from residences, individual residences. Workforce augmentation is going to be challenging. I'm trying the best that I can, but we've activated all the same protocols and we've been pretty good, throughout this whole. Definitely there's some, pandemic fatigue kept in, but for the most part, we've pushed strong on our huddles and our PPE and decon. But the reality is that we can take all of those steps, but all of us are going home and there's no shelter in place directive. So I'm going home to a family of 4 at UConn in middle school and dance class. And so is so are all my team members. So that 80% that we're taking are from residences. We're picking up people that, they're like, hi, I just got my test and I'm positive and I can't breathe and I've had this cough for 3 weeks and I knew I should have left work yesterday sooner. And we're like, oh, you've been working all this time? Where do you work? Oh, at the grocery store? Yes, at the grocery store. Which one? So, I mean, this is the reality, is that that's where we're going to get it. We're going to get it at home. I don't believe our providers are going to get it at work. Or I think that their risk is very, very low, but just making sure that we can continue to fight that. I just went through our COVID exposure plan and prevention exposure for employees and basically rewrote it, took it to Tom McCarthy to get us declared critical workers. But I still want to keep everybody safe. It's one thing to just be like, well, you're just all going to work, put on your masks, but we have to think about all these things. These are the calls I'm fielding all week long. My mom has a fever. Do I quarantine? Do I come to work? We don't know if she's negative. She's got an appointment next week, kind of thing. So I put a few strategies into place based off of CDC guidelines for healthcare workers on how we can, keep our workforce augmented, but still protect everybody from exposure and how to best manage that. And then we implemented the testing. That's rolled out this last week and a half. I can say that on a personal note, it's been incredibly successful. It's going really well. We've got a great team. We've put together a great plan. It's very detailed, it's very methodical, and it's working really well. We've run 2 pop-up clinics for the fire department where we've tested, a bunch of people on the weekend, where we run it like really as a full-on clinic. And we've got it down, it took a couple of days of fine tuning, but now, people are they drive up, we hand them their kit, we talk them through it. It takes 5 minutes and they drive off. No one's being kept waiting. Everything's getting set up. It is a lot of work on our part. I'm not going to undersell it, but it's something that is very, very important to me. Slight challenge with that. The EMS meeting, council region meeting last week, it was brought up by Bob Kenny, who encouraged us to talk about it. Other agencies were wanting to look how to do it. And Bob Kenny basically said that most first responders are going to have to start to get tested by their local agencies, that they're not planning on putting out more clinics. And a lot of the EMS agencies were complaining about wait times for testing. All good news until OEMS, who I'd asked, fought with for 8 months to be allowed to do this, said, oh, by the way, the guidelines that we've been promising you are still coming out, but you actually need an inspection and you need to be regulated. And there's a whole bunch of other things that we haven't told you about, even though we said last week that you are 100% good to go, which for a person like me, as you well know, not great, because I like it. So anyway, tomorrow, the Department of Public Health, FLIS, which is, I can't remember, something and licensing department, facilities and licensing department from quality and healthcare branch is coming down to inspect our site. And then we're going to sign an attestation that we have followed all the guidelines that didn't exist until, by the way, tonight at 6 o'clock. They just came out. Yay. Luckily for you, we are following above and beyond of the guidelines, but there's a few things in the way the guidelines are written that obviously for someone like me who's very detail oriented, I'm a little nervous about, but I don't anticipate too many issues with it. The big issue is that it's worded for first responders only, and we've been doing it for town employees and their families, and I believe we should be. And I believe we should be eventually doing it for the community as well, and I don't understand how we can be allowed to do it for one but not another. I'm hoping to clarify that with them tomorrow. So not without its challenges, a lot of hard work, but I'm going to keep going with it because I think it is incredibly important. We've already seen it. We've caught a few people, employees that tested positive, which is great because they know their colleagues are exposed. They're staying home. They're definitely not going to Thanksgiving dinner. So it works, you know, making this testing available works. And we've also cleared people back into work, that same thing. You know, the person who couldn't get their mother an appointment for a week, the mother came here, tested negative, got an alternate diagnosis of bronchitis from her primary health care, and now that person is back at work without us having to quarantine. We do have extra guidelines in place if they are even, you know, just in those situations, we ask them to wear N95 if they're in the ambulance and they can't be 6 feet instead of the surgical mask. So it's going well, and I'm going to continue to fight, but it has not been without its headaches, to say the very least, and a lot of hours of red tape over and over again. But I think we're in the home stretch again. We were home and then we were unhome. So I'll keep you posted, but I think it should be okay.
Lee, when somebody comes in to get tested,
Mm-hmm.
do they fill out a form ahead of time so that they don't have to fill it out at that, you know, at the
Yes.
site?
So
Oh, they do.
we have them, basically how I've set it up is they have to book appointments, and it's a slow rollout, basically based on resources. So right now it's only offered Monday to Friday, 9 to 12. I asked them to book 24 hours in advance. It actually locks them out 12 hours before the appointment time. It'll just say there's no appointment available. But most people are doing the right thing and giving us that notice. When they put all their info in, it asks for insurance, date of birth, everything that we need. And then the day before the tests come, I then input all of that data into the portal with the lab. I send them an email that helps them establish their portal. So they'll actually get a portal saying, make your patient portal before they've even come to us. We have the tube kit. I scan the tube, put it into a bag. I have a barcode printer, it prints out the barcodes with their name and date of birth. And so it's all set up. So when they arrive, they get sent all these instructions. They get sent how to take the test, what we encourage, what to do, not to do, where to drive, where to go. Most of them don't read it, but that's okay. And then, so basically they drive through Middlebrooks right now because Middlebrooks is predominantly closed. And, you know, we'll look at that when they reopen. It shouldn't really be an issue one way or another. They drive up to the back bay. We move the back bay ambulances. If they're in service, we put them in the front for response. And we actually have, depending if it's just one or two, or if it's everybody coming, if we have a big appointment, we set up 3 testing sites. Each testing site is staffed by 1 volunteer. They have their own table with PPE and the kits. And then we have a person on registration. Registration is for the people that I don't really want to be doing the testing because they're considered high risk for COVID, but they are volunteers and they very much want to be here. So the registration person doesn't, they just walk up to the car in all their PPE and they check name and date of birth and ask them if they've eaten or had anything to eat or drink in the previous 30 minutes. And that's all they do. And then the collectors go, they hand the kits through the window. That we ask them to bring the window down just a little bit. They have to be wearing a source control mask. And then we talk them through it. Then we have them close the window. They do the test. We watch them through the window, kind of just give them a thumbs up, encouragement, knock on the window if it looks like they're about to do the wrong thing. And then when they're done, they open the window. We have the biohazard bag with the other barcode, and they just drop their tube in and we seal it. So we don't even touch their sample. And then we have a biohazard bag that they can throw their garbage in and they drive off. And that's it. The whole thing takes about 5 to 10 minutes, depending on how much spit they can get together and how long that takes, basically. So it's very efficient. The results are coming in right now in 2 to 3 days. 1 or 2 people that, you know, they don't get the portal I will tell you that of all the people that say they didn't get the portal, 99% of them, when I hit resend, say they received the portal, which means they received it the first time. They're just not seeing it. Once or twice, I go back and fix the email, basically. So far we've had positive response. I actually have a template that I'm about to send out tonight to anyone who's tested. It's essentially an evaluation, just asking for feedback, because I think that's important, just to see how they felt it went and, you know, what their confidence level is. And I hope that tomorrow everything will go well. I also hope that the Department of Public Health is just going to do better at talking to each other, because this is the same department. One department says we can, one department says we need something. The letter that I'm signing tomorrow was actually signed by Progressive on behalf of EMS. And they were told that that was all that they needed to do based on our current plan. So by the same people that are coming to inspect me tomorrow, it was signed by them. So it's very, you know, it's just a little frustrating, you know, to go back and forth like that, but I think we'll get there.
I think it's a great idea.
So
I think it'll be a while before you get to the public, but you know.
Yeah, I don't have the resources to get to the public, to be honest.
No.
I would just love to assist, like a pop-up, like 1 week after Thanksgiving. We hire a tent, you know, we get a bunch of volunteers just for one day, and we see how many members of the public we can test at that high risk time. I don't really want to do it permanently. It's a lot of work, honestly.
Yeah.
It really, really is. And you can't delegate a lot of it. Like the inputting into the patient portal and stuff, it's myself and Andrew Weber, because it's everybody's insurance and the demographic. It's just not that simple. And it's all this equipment that Progressive has given me, like with barcode printers, and it's just not that easy to just have anybody do it. So it's a lot of work. At the moment, if I do 36 a day, Monday to Friday, and then a pop-up clinic here and there on a weekend, it's very manageable. But if it explodes more than that, it won't be feasible. So
Take it slow and easy. It'll get there.
yep, absolutely. Slow and steady, and then it'll be canceled and we can go back to having the flu. That's been my biggest thing when people test negative. I had somebody made me test them 3 times, and then they just kept arguing, I'm so sick. And I just said, the flu is not canceled. I mean, yes, get tested once. Yes, come back again in case it was too soon, but possibly get a flu test, a strep test. There are other viruses. Yeah, it's just, at the moment, it's just a little crazy. Anyway, I think everything's going to be fine.
Does anybody have any questions for Lee on that? Everybody okay?
In case you're wondering, last thing on the pandemic, I did write to Kamala Harris and ask if EMS could have a place on their pandemic task force. And I made a case for Trumbull, just letting you know. I'm sure she's not going to read it, but I tried. I'm not even joking. I'm like legit serious. It's a very well-written short letter.
Good for you. All right, paramedic precepting program.
I have the answers to all of your questions regarding Yale New Haven's bringing us their EMTs and paramedics. Yes, Jeff, you were right. They do pay the paramedics. They pay the paramedics directly a specific fee. To Precept, it would be the same arrangement that they have with their other agencies, but they don't pay the other agencies to Precept EMTs. And so they wouldn't be paying us to do the EMTs. So I said I would bring that information back to you guys and see how you felt. And he felt like it was more EMTs initially than paramedics anyway, until our paramedics were more settled and situated.
So what you're saying is they would pay for paramedics to come here and precept, but they wouldn't pay for the EMTs.
Yeah, so the EMTs would precept, and then if the paramedics were precept, they wouldn't pay Trumbull. They actually pay, so they assign a student to a paramedic, and they pay that paramedic, say, you know, whatever it is, $500 for the student for the duration of the precepting, or possibly not exactly like that. I wasn't paying that much attention because I just wanted to know, will you do what you're currently doing or not? And do you pay Trumbull or do you pay the paramedic? The paramedic has to go through their precepting course and do a bunch of steps. I don't believe the EMTs do.
How long is the precept program? Like how long we will take them to actually get on our ambulances for us to help them out that way?
Well, so I think, so these paramedics are just like, it's part of their paramedic students. So I don't know, you know, quite how long it takes for them to for their clinical program.
Okay.
You
Jeff,
could
do
have a
more?
student, you could have a student for up to like 5 months.
Really?
I don't know if there is a time limit on how long they have to complete their ride time, but I've had students for up to 5 months. It all depends on how busy you are. If they're getting all their calls, and you can have a student go through in a couple months, and then it could take 4 to 5 months for a student.
Is there certain guidelines that they have to fulfill in the program?
Yeah, they use a program called FISDAP, and they have to meet certain criteria, certain touches, certain patient encounters, skills that need to be completed. Yeah, so it's all regulated, and it's all through sponsor. So it's nothing that our preceptors need to be worried about. It's the students that have to take on the responsibility of all that stuff.
I think it's a good thing to do. I mean, I think it's a status thing. I think it keeps our medics up to date with what they're training now and what they're teaching the students. And, to be able to say that, we have a bunch of preceptors and we teach, I think that's great.
No, I agree. I think it is hugely valuable, and it does keep our paramedics on their toes. Because I mean, we have newer paramedics anyway, but you don't get to play the whole like, oh, in my day it was just too fast or too slow, because these paramedics are going to ask you and they want to talk about it, and
They're going to drill you too.
I need to be able to answer.
They're going to drill you on questions, and you got to be able to answer them. So
we're living it just with the paramedic students that are EMTs here. They're driving me crazy. I don't really like. The chief doesn't want to let them down. I'm sitting there Googling.
Now, do we have any insurance problem with these people coming to ride on our ambulances?
No, I did look at that. So the students that come to ride on our ambulances are covered by their own student insurance.
Okay.
And then I did reach out to Jean at the town about whatever insurance that we have, because we have insurance that covers students from our program too, as well as like our field trainees and stuff. And she said that it was all, those two combined, it wouldn't really make any difference, and it certainly wouldn't be a cost to us.
Okay, that's good.
The only thing I would recommend is to have you type up a waiver form to have each person that's coming. For a paramedic student, maybe on the first day, just have them sign a waiver form that, releases Trumbull EMS from all liability of it. God forbid they fall off the ambulance or something.
Yeah, absolutely. And I would have them sign our policy handbook as well, just acknowledging that they're working within our policies and procedures.
Right.
All of those things. So, I certainly think it's something we should look at working towards. And I think he's right. I mean, we're not going to be in a rush to do the paramedics. We can start with the EMTs, because all of our paramedics will have to go through that precepting program.
Now, the EMTs are going to be volunteer. They're not going to get paid.
They are not going to get paid.
They would have to understand that.
Yeah. We'll have to see how it goes. I haven't seen if it's an issue. Hopefully it won't be an issue so far. All of our EMTs are so happy. They're town employees now. They're real proud to be here, and they all got a raise just by, what we're doing here. And we talked a lot about them teaching and taking students, and we're very good. Like, we have a program, and our new FTO program, it's evolving, but we're really trying to be cognizant of not overworking the people. And like, we have medic students here, and they're really great teachers. And so, they're in our FTO program, but we've told them, we'll give you a break. You're not going to have to take a student or a field trainee candidate every single shift. We'll make sure that you have shifts where we just block you off as not available. So I think as long as we continue to do that and don't just kind of take advantage of these guys and give them shifts here and there where they're not teaching or training, we should be okay. But time will tell, right? And then Nelson Ambulance is still waiting for me to get back to them as to whether we would precept them. I have asked them several times to give me a number on how much they would reimburse us, and they haven't got back to me. If any of you have any similar paramedic precepting programs that you've ever had, and you can give me an idea of the costs involved, because I wouldn't know where to start. I know that the reason they want to come to us is because Stratford's overcharging them, but no one will tell me what Stratford's charging them. Smart move. It's not going to cost us that much. The big thing it would cost us is whether I have to add them into my scheduling software, because that would be like a per person cost. Other than that, they will supply their own PPE and everything, so it's really not costing us much. And again, I like precepting because it's a great recruitment.
Don't you think we should start with one organization and then roll into the second one after we've got the one established?
Yeah, we can, absolutely.
I mean, that would be my feeling.
The only reason I say, so Nelson has the potential to be very lucrative for us, because I don't know if you heard, Nelson just won the contract for Haven North. There's just too many of them. Northeast, North Haven. Nelson and they were surprised to win it. So they are not even ready. Bridgeport Hospital, I believe, and Milford Hospital combined is like extending medical control up into North Haven for the medics, because they don't have enough medics right now. So Nelson is going to need to precept a lot of paramedics, and it just might be very...
you should strike while the iron's hot.
Might be a good way for us to generate a lot of revenue. And possibly also, like encourage better, high quality standards in our mutual aid partner for their medics, because they are our mutual aid partner, and it would be great to, if they're precepting with us, they're going to see, just a different level of care that we sometimes see from them in the past.
Sounds good to me.
So.
What do you think, Matt? Oh, thumbs up.
I mean, Diane, what about if we said to sponsor hospital, let's bring on your EMTs initially, and we'll stagger your paramedics, and then we go to Nelson and take their paramedics for precepting. So we're not doing both paramedics. Would that be like a good compromise?
That works too. I mean, I think we should take advantage of both, but not, make it a huge burden.
Yeah,
I mean, what are you talking, like maybe 5 people from each organization, or 2 people, or we don't know?
So we can set the terms with all of this. I can go to sponsor and say, I'm going to give you these 8 shifts. These shifts are available to your students and none other, because I want the rest of them for my field training, which I really need, because I have like a gazillion volunteers. Thank you, but it's actually quite a lot of them at the moment. So we can set the terms. So we can kind of look at, when they come to us, see how many they want to send to us, and we can decide if it's manageable. And if it's not manageable, we can say we're not going to be able to do that many. This is how many we can take. And certainly we can set it up in the language that there'll be a trial period, where we can see if it's working out. And then after 30 days, if we decide it was too much of a burden, or we feel we can take more, we can go. I mean, I think all these people are happy to work with us. I don't think this is something that's a partnership more than a, kind of a business deal.
I'm just concerned about so many variety of people coming in on all the different shifts. And is the extra person going to be in the way, or is it going to really be okay?
Yeah.
You don't need to schedule 10 extra people.
No, I get it. Absolutely.
Just my thoughts. So.
No, I think it's very valid. I think we need to look at our schedule and kind of try to get a sense. And I can sit down with my operations team and have them look it up and say, like, what would be easy for you, and start small. Why don't we'll just start small. These 5 spots are for EMTs. These 4 spots are for paramedics, and only on these shifts, and see if it works.
I think it looks great that they all want to ride with us. So
yeah.
This is true. Very true.
It does. It does.
Okay, technology software update.
So the ESO went through, so we are switching our charting software to ESO. It's all just kind of happening now. It's probably, they just sent me something this week on the initial onboarding, and we got to work with EMS charts on pulling all our data and making sure we still have access to that. So I don't anticipate we'll be live for at least 6 weeks. We are also working with our technology department, who've been fantastic as usual, to kind of put together a plan. And this, by the way, I knew that it wasn't the blood bank that I needed my special agency money. This is my backup plan. So we currently have 4 iPads, really 3, because 1 doesn't work. None of which are very great interface with any of the kind of scheduling software or the town software. So we had gone to IT and told them what we needed and asked them if they could look into what they felt would be the most effective thing that would work with all of our software and for our needs, not just now, but also our growing needs, say in a couple of years' time, to integrate a CAD into the ambulances, that kind of stuff. So it's not all finalized, but the goal is that we would purchase new tablets, not iPads, but the IT, there's a word for it. I don't know what it is. It's a Google thing. It's a Microsoft thing. It's just not Apple. It's not Apple, and it's very functional. But then, whether we need Wi-Fi in the ambulances, all that kind of stuff. Technology is looking at what we need and then pricing it out for us. And then the town's probably not going to buy it, and maybe the special agency will. Ta-da!
No, I think it's a good idea. You need to update those things.
We really do. We
You
really
do. I mean, if you get
and if we
lousy
can partner with
software,
the town, and I could take that expense to the town and say, look, we're going to work with you. We're going to take, fund a lot of this out of the special agency side, and then the recurring costs can get built into our fiscal budget for next year. Those ongoing monthly fees, if there are. It's going to be great, and it really is beneficial. Again, we all know it's beneficial from a staff retention perspective when we, facilitate and streamline their process, but it's definitely super helpful from a billing perspective, and from the data analytics that we can then draw on to help plan our budget more accurately. I think it's going to be very, very money well spent, basically.
okay, do you want to have that ready for next month's meeting or our next meeting, or do you want to just send a letter to us and ask us whether we would approve it or not approve it?
I think if I can get it done to you for the next meeting, that'll be great. And if there's an urgency or something, if we get everything together soon, I can certainly try to put it out through a special meeting online email thing. But based on the timeline, I think probably by the next meeting will be realistic. Okay. And because I want to have like proper numbers and data, and not say things like Google, Windows, Word.
Hey, can you find out about reoccurring costs? I remember a couple of years ago when they got the new life packs, they didn't want to go for any type of reoccurring costs at all. I think over for the cell. Do you remember that, Joel?
Yeah, I do.
A
Yeah.
couple of years ago, they
Right.
didn't add on anything, and Diane, you probably remember as well.
Yeah.
And these were critical areas. So I'm not
Yeah,
sure.
and so that's what I've been looking at. So I've just put together this, like, it's my request for purchasing template that I find like really helpful. And whenever I need anything from the town, I put this request in and I use this template. I give the background, I give the justification, and then I give all the quotes, and then I actually break it down into one-time cost, recurring cost, and why. And then I try to like plan out like where I believe the recurring cost will be coming out of, and or if the recurring cost is going to generate revenue, like so that I can show that picture that this is a recurring cost, but we can tap into the hospital's database and get their insurance the same day. The same patient that said they don't have insurance, so I'm going to have that whole document hopefully available for everyone to look at. And I've found, like, most recently, even with ESO and stuff, when I present it to purchasing and finance that way, it's not that they say yes every time, but I think it's very helpful for them to understand those costs and be a little bit more amenable to them. So
okay, and then next month we can discuss how much it's going to cost, what it's going to cost.
Yeah.
And make a decision on it if we want to do it, or if you think it can wait a couple months. I don't know, whatever you want to do.
Yeah, honestly, I think we need to do it as soon as possible, but I've got to like really look at the costs and understand it all, because initially most of this was planned for next fiscal year, but a lot of things happened this year. I would like a refund.
Okay.
Trader Joe's would have refunded me. I'm just saying.
All right. No new business. Does anybody have anything else they want to discuss? Now, next month's meeting is on December 22nd. Is that too close to the holidays, or do you want to back it up 1 week, or do we want to just wait and go in January? What is your privilege? What do you think?
Do you think you can have the stuff if we back it up a week?
Have what stuff?
Bill, do you think I can
What
have
we were
the
just
stuff?
talking about.
Oh, yeah.
It's on Bill now.
It's really, if Bill thinks he can get me the information in time, not to pressure him, because he's like running the whole town, seriously.
Yeah, you look at
Yeah.
Just to be very
No
clear.
problem.
What's the
weeks.
date of the meeting that you're looking at?
Be the
I think, well,
15th?
It would be the 15th.
Yeah, I'm just checking the town calendar. There are two meetings that night, so we can do it, and we should have the numbers in by then.
Okay, is that agreeable to everybody? We're gonna meet on the 15th next month?
Yep.
Absolutely.
Good, that'll.
Because you guys are all
good.
planning big trips for the Christmas
Oh,
break.
yeah. Oh,
Oh,
A
sure,
lot of travel.
I'm good, right around my block. No one's going anywhere.
None of us are going anywhere.
All right, does anybody else have any more comments, questions, anything that they want to discuss at this time?
I just want to say thank you. You guys have been awesome. It's been a difficult year for everybody, and everybody's managing their own stuff. So thank you.
I
for
think it's us
continuing
thanking
to show
you.
up.
Yeah, I think so too, for all that she's doing. Unbelievable, unbelievable. We got the best EMS in the whole country.
Absolutely.
Terrific. We do.
Definitely in the state of Connecticut. That's a fact.
Oh, yeah, but even the country,
Well, that's easy,
Yeah.
but definitely the country.
definitely the country, no doubt.
And Lee's going to Washington?
Yeah. Going to Washington.
You gonna have lunch with Kamala?
Going to have lunch with Kamala. I'm going to talk to her about the Medicare reimbursement and how if we could just fix that fundamentally, then we'll be able to fund EMS better. I have a whole plan.
Wow,
There you go.
beautiful.
But I'm just going to start with let me be on your pandemic force. I'm right here, boots on the ground. You should listen to my ideas. And you should fund EMS with better software for surveillance, and we can help you make better decisions.
Absolutely.
Jeez.
See, Bill, I'm going to get you some funding out of this.
Hey, Lee, did the ceremony happen already for the EMS
No, so, and
agency?
actually I feel awful because Mark Blake actually emailed me this morning asking if Trumbull EMS would be willing to host it on either December,
15.
no,
Yeah,
it's
exactly.
on the weekend. He wants us to host it on December 12th or 19th because I had offered to host it when I thought it was going to be in October, not when I just closed my building down and I was advocating to the whole town that everybody just needs to stay home. So it's a little, I haven't answered him because I'm a little like weighing up, it's December, it's winter. I can't host it outdoors in the bay. I can't go down and take pretty pictures at Twin
Well,
Brooks.
who's going to be able to host it anywhere in Connecticut? I mean, at this point, we're an entire, red zone
Yeah.
state.
So the
What is
reality
it
is I
for?
might be just asking them to delay it even further.
I mean, is it something that we could do in like one of the auditoriums at like the high school? I mean, if they're allowing a certain number of people to attend,
Matt,
that might be something to look into if we can get the auditorium at Trimble High.
The
What
board
is this,
said
what is this
in
for?
the other country.
Only if Lee, only if Lee tests us, agrees to test the board.
It's the Board of
I know
Ed.
you have. No, I know. I'm teasing. Lee's been fantastic to us.
Lee,
Yeah.
what is this for? What is this?
So you know how normally the state of Connecticut gives out the awards that we won the Agency of the Award and of the Year award, and Meg won that award. So normally you go
Right.
up to Hartford.
Right.
So what they did was, instead of everyone going to Hartford, there's 5 regions that the winners are picked for. So they had each region, if you had winners in your region, just have a small ceremony for those winners and live stream it. And they had asked us if we'd host. This was way back when we got it. And I said, yes, you just tell me when. And they just kept putting it off and putting it off. I'm not sure why. So, I mean, there won't be a lot of people at the ceremony because there are four winners from our region, of which Trumbull is 2 out of those 4. So then there's, dispatch. And so, I would imagine they would have a limited amount of people each place can bring. I think Trumbull High School Auditorium would probably be a good option. But again, I'm not sure, if the town, even if the town is going to be open at that point, because if the town is officially shut, they're just going to say no, and I don't blame them because it's a perception thing.
Gonna have to be put off anyway at that point.
Yeah.
Right. Would the town council in town hall, would that be big enough to house it? Probably not.
So,
Probably not.
I mean, there's really not going to be that many people. I mean, it wasn't something even for us that I could invite you guys to. I was going to live stream it to you guys. It's really just going to be the presenters and the award winners. I was really hoping to do it here and outside and in the Bay, because I really would love my whole team to come. Or, at least I would imagine that I could easily have 40, 50 of them, and they should, because it's they won it. This is their big moment, but
Right.
it is what it is. So I don't know, guys. That's why I'm ignoring Mark Blake, which is very rude. So I'm trying to figure it out. I'll let you know.
There's no other place really.
Too bad we don't know anybody that works at Bridgeport Hospital. Maybe we can use their auditorium.
Bridgeport Hospital's already closed to visitors. One person
Yeah.
in the ED.
Yeah, we can't even use our auditorium, man. We got like 20 people that we could fit in there and originally, but now we can't use it again. So it's like, we've got now, I give just for transparency, we've got 120 COVID patients that are admitted, which is half as much as Yale New Haven, and they're 4 times the size. So it's go time.
Wow.
Are you guys following Act Now, COVIDactNow.org?
What's that?
The website COVID Act Now. If you Google COVID Act Now Connecticut, it gives really great, easy to look at statistics where you can see like ICU headroom used per county, which for me is always a big worry. New Haven is not doing well. And you just see the numbers. It's very interesting. I'll send you guys the link.
Yeah, I'm sure.
daily huddles.
I'm sure we report into it because we've been transparent about our numbers actually pretty, from the beginning. But yeah, it's here we go again is the bottom line. We're where we were probably in beginning of April last spring when I remember back, so at least we are not shutting down the ORs yet. But at least as far as like patient census, we're sitting probably at the end of March, beginning of April in terms of ICU and everything else. And yeah, you're right. It's all residents, it's not the nursing homes yet. It's the residents. So
we haven't even had Thanksgiving and Christmas, and everybody is a lot, I think people are done, getting, that's, when I say I use it as my huddles, it's compliance. It's to remind people to be scared, that you need to put your masks on and be vigilant. And unfortunately, I think that the fatigue in the community is there. So I think that
it's not getting better.
Some of them were like, well, it obviously didn't work. Why try? I'm just going to have my giant Thanksgiving dinner. So we'll see.
Fingers crossed.
So yeah, I'll let you know about the awards, but I'm going to talk to Mark just about the option of potentially just, let's just wait until buildings reopen again. It would still be a small ceremony, but maybe a safer option.
Yeah, have them wait till the spring so you can do it outside.
Yeah.
Like April. The end of
Combine it with
April,
next
May.
year's winners.
Yeah.
What?
Absolutely.
Combine it with next year's winners.
True.
Or 2 in a row.
There you go. Yeah, there you go. It'll just be us again. So
There you go.
Not the 4 people.
It wasn't in year 3 plan. It was really year 5. Too much pressure. Too much
There's probably a building down in Washington when you're down there. You could probably choose.
yeah,
Yeah, I'll talk to Kamala. Maybe she'll help me out
that works.
to get my new building. She'll help me figure out how to get stuff off the capital plan wish list and into like the capital plan real world. Don't know how that works. I'm still working on that. All right. Listen,
All right.
everybody be safe. Thank you again for
Yeah.
everything.
Need
that
a
did.
motion.
Thank you, Lee.
Oh, yeah.
Thank
need-
you. Motion to
I'll make a-
adjourn,
I'll
Shay
make a motion
Greg.
to adjourn.
Okay, motion to adjourn. Who's seconding it?
Okay, I'll second.
Yes.
All right, all in favor?
Aye.
Kate, good luck.
Yes.
Let
Okay.
us see this little sweetie when you have her.
Thank you. I will see you guys all in March when I come back.
Excellent.
Sure. Well, good luck with everything.
Thank
Yes.
you.
I'm sure it's gonna be fine and you'll have a beautiful little girl, right?
It's a boy.
Oh, you got a little boy.
A little
Oh,
boy.
okay,
There you
well.
go.
I got a little boyfriend for Tom's daughter.
That's all
See,
right.
that's good. That's
Don't tell him that. I don't think he'd like it.
A younger man. Oh boy.
all right. Have a
Well, be
happy and
safe.
safe Thanksgiving,
Happy
everybody.
Thanksgiving,
Thanks for
everybody.
coming.
And you too.
Yep.
See you
Take
next
care.
month.